Iingxaki ezininzi esizibonayo ngabantwana abangondlekanga kakuhle. Ngabantwana ugonyo lwabo olungaphelelanga.
South Africa has the curse of arrogance. I think it has a lot of money and has a lot of confidence in a system where everything indicates that our systems are breaking down. We all think rural is important. We all, feel for rural healthcare, but we don't really know what that means practically. And the Rural Doctors Association and the Rural and the Advocacy Project have both brought that coherence. They've said, this is what practically it means. This is what you should be doing. This is how your policies should be informed.
Together, we are trying to advocate for the right of rural communities to achieve and access a healthcare service which is of a good quality and of an equal quality to communities in urban areas.
The degree to which rural healthcare is still behind what's being provided in urban areas, I think that often people are not aware of it. I think policymakers sort of forget. It's far away.
Rural areas are very different to city areas, and I think we forget that nearly 42 or 43% of our population lives in rural areas, and I think that people tend to forget what's going on, but forget about the challenges in terms of transport, the challenges in terms of resources, the unavailability of private medicine, for example.
We rely to Mthatha Hospital to phone the ambulance and take time to get here.
So we are a hub of rural health care information and action, but we do that in partnership with a wide range of stakeholders.
They've brought a consensus that they're kind of the go-to people for some sort of coherent policy. And for that reason, I think they're in a very powerful position.
If we can show that there is inclusion of the coal-face views within those policies, that is reflected in those policies, then we can be satisfied that we are getting that rural voice and we are advocating for rural healthcare appropriately.
We often find that policy that's been designed at national is just seen as a hindrance to our services being provided, and that's not how policy should be. Policy should be improving the way that we can provide services, and that's because those policies haven't been rural-proofed.
So we want to make sure whenever a new piece of legislation comes out or a new policy is developed, it is implementable in a rural area, and it also promotes the interest of rural communities and rural healthcare workers.
If we can get it right, rural health will have its pride of place, and that more resources are required to essentially produce the same health outcomes that we're trying to achieve in urban areas. We're getting there with respect to the importance that rural healthcare is taking both in policy and implementation.
Singqongwe ngoomama abasaziyo, noba uyazihambela awukho semsebenzini, uyeza umhlali azobuza ingxaki kuwe, uyayazi ukuba iza kusonjululwa kunye naye, kunye nazo zonke abantu abamele uba banika izibonelelo kule ndawo.
So we're coming here with paying nothing. They give us more medications for our kids. So I thank so much.